Welcome back to the Best of Health podcast. My goal is simple. Each episode, I hope to provide you with insightful conversations with a varied scope of healthcare professionals, clinicians, researchers, functional medicine practitioners, and industry leaders to open up the dialogue to inspire you, the listener, to consider that declining health as we age is not a given, and that with the right information, many chronic diseases are indeed preventable. I hope to engage and inspire everyone to achieve the very best of health. And today I'm talking to Ben Brown, who is probably one of the most educated functional medicine practitioners that I have ever come across. And we talk about what IBS is. We talk about how many diets are restrictive, such as FODMAP, and we talk about his opinion on gluten-free and so much more. So welcome to the Best of Health podcast with Ben Brown. So welcome back to the podcast, and today I am absolutely thrilled to have a colleague and a very esteemed naturopathic physician, Ben Brown, on the podcast today. Ben is an Australian qualified naturopath, and I've heard him lecture and teach many times, and he was one of the most inspiring lecturers that I have come across in the UK, and he stood next to Geoffrey Bland, who was extolling the virtues of Ben's work, and anyone that follows the world of functional medicine will know that that is praise indeed. So we are very honoured to have his expertise here today. Ben also has run for many years his own clinical practice, but he now writes both. He's published a book which has been updated, specifically on digestive health and IBS, which we're going to talk through a lot today. And he has written and had published many published papers. And he is also the education director of Pure Encapsulations here in the UK. He also lectures for many of the esteemed colleges here in the UK and for many functional and integrative organizations across the world. So without further ado, Ben, welcome. Thank you so much for joining me today.
Yeah, it's a pleasure to be here, and I'm excited to have a conversation about this and share your experiences as well as mine with the listeners. It'll be fun.
Great. Okay. So, Ben, I spoke to the listeners and they can hear your lovely accent, that you are from Australia, and maybe a great place to start before we maybe delve into the area of your expertise a little bit is, what was your journey and route into naturopathic medicine?
Yeah, it's a great question, and the ongoing joke in the healthcare profession industry is that we all got into this with our own problems. And
Yeah.
And it was a little bit like that for me. So I had a serious bout of illness in my late teens. I was diagnosed with chronic fatigue syndrome, and that was a horrible experience. And to cut a very long story short, after months of not really getting answers with sort of mainstream medical options or any improvement, I saw a local naturopathic physician, an osteopath, like a really fantastic guy. Very sadly passed away last month, and but was practicing until then. And he essentially put me on a very simple program. By our standards today, back then it was low reactive diet, high dose vitamin C, a few other things like a multivitamin, and gave me a sense of optimism. And it was just phenomenal. Like, I've never experienced anything quite like that since. I had like a 50% improvement in, from being bedridden to really getting out of bed. It was just phenomenal. And what that did is it actually started to clear up a lot of other things, health problems I had at the time, allergies and blah, blah, blah. But what it really got me interested in, and why it was pivotal for me, is it got me interested in self-care and learning about natural medicine just to look after myself. And then years later, when I was looking at university degrees, I naturally gravitated towards natural medicine because I had my own interest in it. I also love science as well. Like you get to study like medical science and
Yep.
biochemistry and all that. So cool. So I thought like, this is like awesome. Never thought about doing anything with it, but I loved it. I loved the course and really applied myself and did reasonably well and came out of that, you know, pretty enthusiastic to sort of share that and help people. And, you know, that's sort of how I fell into it a bit indirectly and through my own health journey.
And then you came to the UK quite soon after that, and you.
Yeah, well,
you've been here a long time now.
Yeah, I have. Yeah, so I spent quite a bit of time in the industry in Australia, and then I moved to the UK, and as you kindly mentioned, I've been involved in quite a lot of things since then. You know, private practice, educational, editorial research, and lecturing, and all sorts of stuff. But it's been a really fun journey, and the UK is a really dynamic and evolving landscape for this kind of patient care.
Fantastic. Excellent. Thank you. So I've mentioned, and you have just explained your journey. You've spent a lot of time writing and researching and publishing, both for, I would say, for the general public, but also for healthcare professionals, and sort of at a very high level. So I'd like to sort of bridge that gap today, if I may, and if we can. Your book, the Digestive Health Solution, which I believe you have just updated quite recently. Is that right?
Yeah, I think it went through a second edition a couple of years ago now, but it did go through a quick revision. Yeah.
Okay. And so the term IBS is such an umbrella term that so many of my clients and your historical clients and is given to. And you very articulately write in the book that it's all very well to have the diagnosis, to have the label, but it's very much centered around where we're going to get leverage is about uncovering the underlying causes of that. And how would you could you put those into sort of pillars or buckets of areas of underlying causes?
Yeah, absolutely. And, you know, something I'm really interested in with IBS, and I think this comes across in the book a bit, but I've since published a few papers that I think dive a bit deeper into this, and research papers. And one of the things that I think everyone is naturally arriving at with IBS is that there are unidentifiable underlying causes. So the unfortunate thing for patients and people who suffer from IBS is they're not taught that. You know, they're told that after they've had a bunch of tests done that they've probably got IBS because nothing came back.
That's right.
And you've got to live with it. Like, you know, I've had people who've been told, "Oh, just like eat some yogurt and it might get better." It's like, oh my goodness. And, you know, we laugh about it, but for some people it's devastating. Like it really is. It massively impacts their quality of life. They can't hold down jobs, relationships. They're in constant chronic pain. It's horrible, you know, and so we really need to do better by patients. And something I've become really interested in is like, what is causing it? You know, so what can we identify, you know, that's really tangible? Can we test? Can we look for that? You know, can we make changes that, you know, would have previously been contributing to the symptoms? You know, how robust is the evidence for these recommendations or tests or whatever? And is there evidence to show that doing something about it helps people? And there is. And I published a paper along this theme in the journal Gastrointestinal Disorders a year or two ago. And the title was something like, "Does IBS exist?" And what I did with that review is I dove into exactly that. So what is causing it? What can we look for? And what has good quality evidence showing that if you action it, people get better. And I can't remember the number, but I think there was like maybe 20 or so different underlying things that we know now that could be causing or contributing to IBS. It's never one thing, unfortunately.
No,
it's usually a couple, but they all contribute, and we can action them. And your question, can we group these into areas? For sure. I sort of distilled it into 3 for the sake of the construct of the paper. It's sort of basically diet and lifestyle things, environmental things, and then what we might call functional problems. So yes. Things within your physiology or your body that could be part of the cause that we can do something about. So yeah, we can definitely look at it that way. And I think it's much more empowering for people to understand that there's something potentially they can do.
And that's interesting, because that then provides for any physicians or any type of anyone working with clients, it provides a roadmap for working across or around, or however your brain works, in terms of having a structure of being able to work around those different contributing factors.
Yeah, absolutely. And I think that's exactly where it's all at, is like where this change needs to happen is with physicians and healthcare providers, is we need to get beyond just labeling something IBS and then giving people symptomatic treatment or none at all, and start to ask better questions. And to give credit to all the great healthcare providers out there, we're not given the right tools, and we're not taught this as well. And some of this is really preliminary evidence. It's not the most robust thing in the world. So I don't expect any nice guidelines soon coming out along this theme, because we don't have a lot of really high quality data, but we've got really good indications that there's something to all this, and that we could be doing better by people.
Yes, I wholeheartedly agree. And I think that there is definitely a failing in a lot of the education of healthcare professionals as well. That when it came out, the sort of the 4R or the 5R, which was an approach that kind of worked, but we've moved far beyond and exceeded that. And again, it's too linear an approach.
Yeah, definitely. That's a good point, actually. I was talking more about conventional medicine, but definitely there is a bit of confusion and sometimes oversimplification in even more integrative medicine as well. And I think that's probably where really functional medicine, and I would argue that nutritional therapy is functional medicine. That's where the strength is of these disciplines, is we're really looking at people as individuals and trying to identify more organically underlying causes rather than follow protocols. There's a bit of that that's sort of dragged on through history, but I think we're moving beyond that. And the functional medicine approach is a personalized systems biology approach. It's not a protocol approach.
Yeah, perfect. Yeah. Perfect. So if we sort of circle back to one of those broad areas, if you like, which you talked about, diet and lifestyle, there are many, many different diet models that are used and talked about within the area of digestive health. And a very popular one is FODMAP. And is that a model that you have seen to be helpful? And B, maybe if you could just explain what that acronym stands for some of our listeners that might not be familiar with that.
Yeah, I love this topic, and I've got a lot to say, so stop me if I'm talking
Brilliant.
Too much. But it's a really good question, because this affects a lot of people with IBS. They're told they have IBS, and then they're put on this FODMAP diet. So for listeners, FODMAP is an acronym, a long one, for different types of fermentable starch. So I think it's like fructo oligo di mono and polyols and something like this. But yeah. The thing is, it's basically referring to different foods that your gut bacteria can ferment. Technically, it's not doing that, but that's a whole nother thing. But the FODMAP diet, basically, if you're a patient, is quite entailed to follow. You really need to be under professional supervision. It's very hard to do yourself well, or really appropriately. And essentially, it's a kind of an elimination diet. So you're eliminating, either based on testing or symptom provocation, different foods. So there are a few things to understand about this diet before we poke holes in it. The first is that it works really well. So there are a lot of good clinical studies on it. There's like a really high response rate. If you just give this to everyone who has IBS-like symptoms, most people feel quite a bit better. However, because of that, I will add, it has fallen into like mainstream guidelines for the management of IBS. So it's commonly recommended and referred to. Now, there are a few problems with it that I want to point out and that I think are really, really important. One of them is that it's not the only diet that works. The reason it's in guidelines for IBS is because it's one of the best studied. That doesn't mean it's the best diet. And what's really important to get across, I think, is that there are problems with it. It's very restrictive. It may have adverse effects on your gut bacteria, for example. It may have adverse effects on your mental health. A very high percentage of people who are following a FODMAP diet actually fulfill criteria for eating disorders because of the nature of the diet. But, you know, you can put one and one together and you've got, you know, there's a potential issue there for people who are susceptible to this. And when I say it's not the only diet, there are other diets that work often just as well in clinical research. I'm not, you know, this is not just anecdote. And these include things like a gluten-free diet, a Mediterranean diet, what we call a traditional IBS diet, which is like just cut down on onions and chew your food and don't eat too many spices and like just really simple dietary advice. In fact, there was a brilliant study that compared, I think, a low FODMAP diet to a gluten-free diet to a Mediterranean diet. Quite a recent study, and just for listeners, they all worked just as well for reducing symptoms, but the compatibility or the likelihood, so they measured this in the participants, that people would follow a low FODMAP diet was the worst. It was like 9% or something crazy. Like, no one wants to eat this diet. It's horrible. It's restrictive. Yeah. It was a bit higher for gluten-free because it's really easy compared to a low FODMAP diet. It's arguably much easier to do. But then the Mediterranean diet is just like healthy eating. So you get to eat everything within reason and it's delicious and it gets symptom relief just as good as these other diets that are really restrictive. You know, so the acceptance of this amongst participants was like 90% almost. So, you know, I think this is really one of the problems with the low FODMAP diet is it's tough and it's restrictive. It may have adverse effects and there are probably things that are better and more easy to follow.
It's interesting. So the low FODMAP diet came out of Australia, and yes, and it is incredibly restrictive. And I think that's so to explain that to sort of listeners, it takes out onions, garlic, a lot of what are called the brassica vegetables, so cauliflower, cabbage, kale, broccoli, and a lot more. But it is, so these form the foundation of many, many foods that have also very many health benefits. And I think that's very interesting that you've referenced that can impact mental health, because we know that the gut microbiome plays such a integral role, and there's this continual chatter with the metabolites of the gut microbiome and our nervous system. So that doesn't surprise me, but I think that mechanism maybe is something that we could talk to a little bit in terms of that interface between the gut microbiome and the nervous system and of course the immune system.
Yeah, absolutely. Like, you know, really happy to jump into that. And, you know, I think you know, if you look at the physiology of IBS, like there are different causes, but there are a few commonalities amongst the what's actually going on. for most people. And one of the really characteristic things of IBS is there's an imbalance in gut bacteria, and that's a bit of a simplification, but it's a hard thing to put a finger on scientifically. It varies from person to person, but generally speaking, when you test the gut bacteria of people with IBS-like symptoms to people that don't really have much symptoms or none, that their gut bacteria is inherently a bit different. And what we think is happening there is that's really intrinsic to the development of gastrointestinal symptoms, is this imbalance in gut bacteria. And there are really two phenomena that are occurring that are fundamental. One of them is fermentation of food. And that's producing a lot of gas and toxic byproducts that wreak havoc in your gut. So there's this over fermentation. And the other thing is interaction between those gut bacteria and your immune and nervous system. And that mucks up the muscles in your gut and causes things like constipation for some people, diarrhea for others, pain for most people. And and it really comes back down to this interaction between your gut bacteria and your enteric nervous system. And definitely there is, with that in mind, a strong link between irritable bowel syndrome and psychological and even cognitive symptoms. And by that I mean more predominantly anxiety, but it could also be things like brain fog and depression, but more commonly anxiety. And the mechanisms are really interesting, but this thing we oversimplify called the gut-brain axis, is insanely complex. There are lots of different pathways by which your gut bacteria can affect your nervous system, which we can't really go into. There's too much going on there, but we know that's happening. There's an interaction and crosstalk, and that could be driving things like anxiety. And this is a really interesting understanding for people because, often, sadly, people with IBS are told that it's partly in their head, like you're just an anxious person, you've got an anxious, irritable stomach, which is half true. Definitely your nervous system impacts your digestive symptoms, but it's not in your head. It's an organic disorder in your gut, and it's often affecting your nervous system. And in fact, it's more frequently the other way around, in that your gut is making you anxious. So it's it is a really interesting piece of the puzzle within digestive symptoms for people.
And so that nervous, the what we refer to as the enteric nervous system, and the gases or the metabolites that some of the bacteria produce, is there a connection with that for what we call visceral hypersensitivity, when people feel it's painful to touch their abdomen or their stomach? Is that what you're referring to, Ben?
Yeah, 100%. That's the technical term, exactly, bang on. It's known as visceral hypersensitivity, and basically what that phenomena is, and you've described it quite well, is it's like a sensitivity to touch. And this is really, I think, important to understand if you have irritable bowel syndrome or similar symptoms, is that what seems to be happening is the nervous system itself within your gut is highly sensitive, and it's not just in your gut. It often is affecting other parts of your body as well, which is why we frequently see things like headaches and muscle pain and other symptoms in people with gut symptoms. And and what it means more practically for people is that eating sucks. Like it's and this. Basically, the normal process of eating is painful. Like the passage of food through your gut is painful. And this is really important to understand, I think, because often people falsely attribute, and I say falsely, with a pinch of salt, because it is still causing your symptoms, but people often falsely attribute certain foods with gastrointestinal symptoms because they are getting pain, but it's not necessarily always the food technically that you're reacting to. It's you, not the food. So you can be eating really healthy, normal food. There's no allergic or sensitivity or other type reaction. It's just that your gut can't handle digesting. So it, really important part of the healing of IBS, I guess, is to try and reduce that visceral hypersensitivity so you can live a normal life and eat normally.
Yes. And
Or
actually,
eat without pain, I should say.
yes, indeed. And do you then, if there are many interesting functions and necessary functions of the gut that we fondly call it, the technical term, the gastrointestinal tract, but we're not going to call it that every day. And if we think about it from top to bottom, the beginning part is as you've alluded to, is the chewing, and is or before that, just us conceptualizing eating, and that triggers enzymes and amylases in our mouth to start the digestive system to prepare for. And so could you maybe speak to how stress and mental stress would inhibit that, and that could then contribute to IBS or some of those symptoms as well?
Yeah, absolutely. I mean, I think the term you used just there is perfect. It's the sort of top down relationship, and we frequently see like anxiety and stress as part of the picture of IBS, and although I've just said it's not all in your head, the cool thing is you can actually use your head as medicine, and things like cognitive behavioral therapy, psychotherapy, counseling, mind-body therapies, deep breathing exercises, mindfulness, like all of these things have been shown to work really well for people with IBS and help improve gastrointestinal symptoms and reduce pain. And of course, the side effect is you also reduce a lot of the symptoms of stress that come along with it as well. So, I often use this term top-down approach. I think with IBS, you've got two ways of tackling it. You've got bottom-up approaches and top-down approaches, and it's and both work really well together. I really believe that for most people it really requires a bit of an integrative type approach, and these top-down as well as these so-called bottom-up approaches are very much can work in harmony.
Absolutely. And so again, so to be clear, we're talking about optimizing digestive secretion. So be that stomach acid, be those enzymes, be that bile, making sure that bile flow is optimal. And there are certain medications and lifestyle impacts that can inhibit that to occur. And so actually thinking about that from a bottom-up situation, there are the two. Constipation is something that you've spoken about in your book, and there can either, and if we think about back to your areas of the way that we look at this, quite commonly, if a structural component has been ruled out, if there is a kink in the hose, so as I sometimes describe, there can be certain foods that can help that, what we call that wave-like peristaltic movement. And the lovely kiwi could you talk about that a little bit?
Yeah, absolutely. This is such an easy way to improve IBS that everyone misses. I think it's crazy, and I think the reason constipation and IBS are or constipation is missed as a cause of IBS is because we think of them differently. If you're constipated, that's one thing. If you have IBS, that's different, but they overlap loads. People with constipation get loads of bloating and pain and fatigue, and it's bloody horrible. And also, and the confusing thing is that often people with chronic constipation will get intermittent bouts of diarrhea when they're stressed, when they eat bad food. And, for most people, that looks like textbook IBS, not constipation. So, we sort of then go, well, we're not thinking about constipation anymore. It's IBS. Oh, man, that's complicated. We can't do anything about it. But if you come back and say, well, actually, it could be just constipation that's causing all these IBS symptoms, there's loads we can do about it. And there was a group at Oxford that were the first, arguably, to really identify this as an issue in a subgroup of people with IBS. They called it overload overflow syndrome, where you just kind of bank up constipation and then it bursts and it looks like IBS. And basically their treatment got me thinking. So they were using laxatives, quite strong ones like you would take before you go for a colonoscopy, and just clear everything out. And then they would give fiber afterwards, flax seeds mostly, because they're quite well tolerated. And they have case reports published in the literature of people getting IBS free on this protocol for like years. It's just awesome. So I got thinking about that, and I'm like, well, you know, I'm not going to be giving people bowel preps, you know, to clear them out. You know, there's some problems with that for obvious reasons. Is there a way we can do this more gently and naturally? And, you know, you go back to the literature and, you know, sure, you could use supplements and stuff, but what about food? And it turns out that kiwi fruit, these little, you know, green ripe fruit you can get everywhere, are rich in a substance called actinidin, which is an enzyme. And actinidin has two really interesting functions. The first is that it breaks down food like a digestive enzyme. That's great. But the second is that it actually helps with those movements you've just mentioned. So it actually seems to help with muscular contractions in the gut a bit as well. And, you know, lo and behold, if you look in the literature, there's like probably about, I'm guessing there's about 8 or 9 studies now on kiwi fruit showing it works really well for people with constipation. And the regime's simple. You just take 2 or 3 kiwi fruit each day with breakfast. And within about 4 weeks, you're going to have a really good improvement in your gastrointestinal symptoms. And it's natural, it's free, it's no side effects. And it's super nutritious as well. Like their superfoods are amazing.
Yeah.
So I, you know, in the book, I, you know, invented a term called the kiwi fruit cleanse, and I'm hoping that the kiwi fruit industry sponsors me one day. But
they might fly you home. You never know.
Yeah. Bypass New Zealand, but it just works. You know, it's really gentle. It's quite easy to do. It's, you know, and I think for a lot of people, it can, you know, just be a very simple solution. And you know, I also like the idea of just using food as medicine. Of course, constipation can be more complex, and, you know, it's definitely worthwhile seeing a nutritional therapist if you don't, you know, if you're not getting results or whatever. But you know, it is definitely one simple thing that you could try, and it certainly can be quite helpful.
Absolutely. Thank you. That's great. So we hear a lot about a subset of IBS, or it's attributed to being up to 85% responsible for IBS, called small intestinal bacterial overgrowth. And I personally sort of feel that we're in danger of this becoming the next sort of candida of our generation. But being sort of immersed in the literature and teaching, I was keen to get your sort of understanding on your thoughts and where you stand on this particular topic.
Yeah, it's an interesting question, actually, and I have a somewhat counter and controversial view, you know, to people that are really entrenched in working with SIBO. I think most of the time people who are working with SIBO are not actually working with SIBO. And really the controversy is simple. The tests we have for SIBO are really problematic. They give a lot of false positives and a lot of false negatives. Even if you standardize the protocol, they're still not very good. So the issue we have is that when we're talking about SIBO, there may be a misdiagnosis in a substantial amount of cases, or, you know, misdiagnosis, I mean the test pointing to the problem, it's not a medical illness per se.
Sure.
And I'm talking about breath tests, basically. So the issue then we have is if we've got a shaky test and then we're basing treatments on it, what we think we know about the treatments could be wrong. So, for example, one of the more conventional mainstream treatments that's been studied for this issue is antibiotics. So a special class of antibiotics that, you know, help with digestive symptoms. And the issue with these is it may be that they're working not the way we think they are. So the theory sounds good. You test, you get SIBO, comes up positive, you give people antibiotics, they get better. But we know that they don't work very well. Firstly, their symptom, relief doesn't last very long. It tends to reoccur. And also, if you give people who are tested negative for SIBO, they also respond really well. In fact, just as good. So we have this real conundrum. And I think that, there's really, it's a problematic thing. It's just difficult to concretely say someone has SIBO based on a breath test.
Mm-hmm.
And therefore all the treatments that have been based on breath tests are potentially not working the way we think they are. So it's definitely not 1 + 1 = 2 a lot of the time. And it could go more into like things like the reasons why the test is not great, and the reason why the so-called treatments might be working and for other reasons. But I think my take home on it all is yes, definitely gut bacteria are something we need to know a little bit about. But the problem is there's so much variability in the gut microbiome from person to person, and there's so many problems with labs that really all we're getting is a sort of indicator. And I think it's useful to test the gut microbiome as a general indicator.
It'd be my next.
Yeah, but you don't want to get too hung up on specifics, because you're hanging your hat on a hook that's going to fall off the wall tomorrow if you test the same thing again. And so and also this whole approach is just not really, there's just not a lot to it. Like it's sort of been developed as a more commercially, I think, like, I've got these tests and we've got these products, and you do all this stuff, and it just doesn't add up. If you look at the literature by leading gastroenterologists in this area, like everyone is saying that we can't do this. Like, you can't test and treat the microbiome. No one is doing this. No one studied it for a reason, because you can't. It's too complicated, and it doesn't work like that. But that's sort of the pitch that consumers are being told. Like, our patients are going and using these labs directly as well. And also what practitioners are being told is, that these products are lab tests, and probiotic, these kinds of things are being sold. So for me, a big wake up call for me is, I publish a little bit of research. I'm definitely not an academic scientist, but I tell you what, try and write something up on SIBO and get that through peer review, because you'll get shot down with a lot of the stuff that people are saying, because it just doesn't hold up in the science. Like, you can't test and treat and all this sort of stuff. So, it is a very controversial and disputed area in the scientific literature. I think it may have a place, but where I think it sits is at the end of doing everything else you can as a last resort, because it's there's a hell of a lot of other things you can be doing to help improve people's symptoms before you start doing a breath test. And yeah.
And you mentioned something just there about the microbiome. So with SIBO, we're looking at possibly the gut bacteria being in the wrong location in broad terms. So there's more bacteria in the small intestine, which is predominantly designed to be doing the final digestive function and absorption of our nutrients. And so if there's an overgrowth of bacteria there, then it can get in the way, so to speak. But you talked about there being these, and there are so many now, commercial tests around the microbiome in its entirety. And I have taken to describing the microbiome fondly as likening it to the barrier reef, in terms of, we want a microbiome that has got depth and color and variety of species, and that it extends beyond the eye, and it's just the concept of its vastness is just so broad that we can't put a figure on it. So therefore, testing it, how beneficial is that for us to be asking our clients to do that?
Yeah, it's a hard question, and I'm probably not going to make friends by answering this, but I think there may be a bit of benefit, but it's important to understand that it is experimental, and it's not something we can concretely base treatment on. I can't think of something to liken it to, but it's a little bit like saying it's kind of interesting to know, but it's not going to massively impact treatment recommendations and outcome. And I think the way you put it is quite beautiful. It's very vast, it's very diverse. It's interesting to have a glimpse at the barrier reef and take some photos and come home, but good luck trying to change it. And by moving the coral around, I don't know. So it's the ecosystem is its own ecosystem. And I think someone who put it beautifully for me was Miguel Toribio Mateus, who's done a bit of work in the microbiome area as well. And he said it's a bit like you've just got to nudge it in the right direction with diet and lifestyle changes. Like, it's really good to look at it, but you've just kind of got to nudge it in a healthy direction. And we don't even know what a healthy direction is. There's an argument that some of the barometers we're using, like diversity, are not really good barometers, because you can have very good functionality with low diversity. So there's still a lot of questions around this, but there are some general metrics that you could broadly use. Some labs are providing them, like beta diversity indexes and dysbiosis indexes, that I think are probably in the long term are going to prove to be more valuable than looking at individual species or bacteria. It's sort of a snapshot of the overall microbiome, and genetic testing is working the same way. It's like, good luck trying to tweak genes in a human, or understand even nutrigenomic interactions or disease risk interactions. And a lot of where genomics is going is like polygenic risk scores. So you don't look at one gene, or in our case, one bacteria. You look at hundreds and see how they're working together in a dynamic system. And I think that's there's probably some value to it, but I think there's a lot more important tests you could be doing up front than checking the microbiome per se. I think parasites definitely more important, and they fall into that, but there are other tests that I think are inherently a lot more useful.
Yeah. And I think that segues into integrative functional approach of always considering whether, and not pigeonholing oneself, or going to a practitioner that specializes in SIBO or in gut health, or because the body is completely interconnected. And we can circle that back round to constipation. It's a care of duty that we need to rule out, well, is there a thyroid issue, as an example? Is that why wave-like motion is slower? It's about thinking about this from a broader perspective and truly holistic. So truly sort of thinking about that interconnectedness.
Yeah, that's so beautifully put. And I think that's a great way to ground all of this in a bit of common sense and logic. Is, one of the dangers, I think, of the world we live in now is we have, for many reasons, we have, overabundance of technology, and that's filtered into medicine, where we have a lot of data now. And, SIBO is a great example, as we've got an easy access test that provides us an interesting insight, but you don't want to use only that as your treatment approach, or get stuck on the microbiome, because as you just beautifully put it, it's connected to everything else. And we know that diet and environment and proximity to nature and owning a dog and all of these things affect your microbiome. It's like, absolutely. So here's the question then: should you be testing your microbiome, or should you be asking your patient if they have a dog? It's like,
I think the latter. Yeah, I think the latter.
You know what I mean? Like, it's just, it's where do you ask the questions? And sure, we know the microbiome's disrupted, but for me, the more important question is why.
Yeah, absolutely. And so I think the maybe sort of to close this particular conversation, but hopefully you'll come back and we can talk some more. But I think obviously diet is a question, and that people are always, it's the holy grail. People, what's the right diet for me? And I think that of course, I'm not going to ask you to say that, but do you have a view on I've heard you talk about the 3Ps before, which are prebiotics, probiotics, and maybe the more common friend that we're talking about is polyphenols. So polyphenols are the beautiful color that gives the color to our plants. Do you have a view on the benefit of increasing polyphenols in the diet over? There is also some papers that I've seen about of being on a carnivore diet. Do you have any personal views on that?
Yeah, absolutely. I think it's a really important and unanswered question is what's the best diet for your microbiome? And someone put it really well. It was Michael Pollan. He said, we're not, what we've learned with microbiome research is that we're not eating for one anymore. We're eating for like 100 million.
Nice. Yeah.
which is a great way to put it. And what we've learned, it's, you mentioned these 3Ps. So in the 70s, we worked out that fiber is really important. And so we call those prebiotics. And then probiotics we've known about for ages, but they kind of like bit of a resurgence in the 90s, I guess. And then, polyphenols came into vogue, a decade or so ago. And but what's been amazing for me to see, like keeping an eye on the science, is that basically everything falls into the category of affecting your microbiome. So, for example, you can give someone vitamin D and that changes their microbiome. That's a microscopic amount of a vitamin. You can give someone a bit of an artificial sweetener, which is microscopic. That'll change the microbiome. An amino acid, fatty acids do it. Like you give someone a capsule of fish oil and their microbiome changes. It's just so, like, basically everything you're doing and everything you're putting in your mouth will change your microbiome. So it's not really 3Ps anymore. It's basically your whole diet and every food you're eating has an impact on your microbiome. And, what is the best diet? We don't really know, but I think there is some emerging concepts that are really important. And one of them is diversity. As soon as we have diversity in diet, we have diversity of food for microbes. And we're more likely to encourage a broader range of microbes. And generally speaking, we think, as where we're at now is that diversity is really key to a healthy ecosystem. So I think if there's one take home for all of us, it's like diversity of healthful foods, mostly plants, as Michael Pollan also put it, is probably one of the immutable bits of advice that will never change in terms of what is healthy for your microbiome. And definitely it's likely that more extreme diets will emerge and become popular, like a paleo diet and all these sorts of things. And they have been studied for their effects on the microbiome. And basically it's these more diverse diets, like a traditional Mediterranean style diet, that do appear to be better because they're more diverse for your gut microbiome. So, I think for listeners, it's, rest easy. It's not a FODMAP diet. You don't have to restrict loads of stuff. It's really thinking about abundance and diversity and natural plant foods, herbs and spices and fruits and nuts and seeds, and trying new things and eating seasonally, and, which is what food should all be about, right? It's about abundance and flavor and color and taste and trying new things and having new experiences. So it's a good message.
Actually eating with joy, and that circles back round to the mindfulness piece and the eating in a Mediterranean way as well, not just the food, but for a long period of time and with laughter and friendship and music. And hopefully we will all be able to do that again very soon. Even if it's sat outside a cold British pub when it's snowing, but
yeah, absolutely. Yeah, no, it's beautifully put. It is much more than that. Like, food is this force that connects us all, and it should be about abundance and joy and connection. And I completely concur with you on that.
Yeah. Ben, thank you so much for coming today. And if anybody we'll put the details in the show notes, but Ben's book is called The Digestive Health Solution, available from all good bookstores and on Amazon. And for healthcare professionals, Ben is speaking at the upcoming ICAM conference, and is always anything that Ben speaks at, you buy a ticket because you will learn so much. So thank you, Ben, so much, and hopefully you'll come back and speak to us again in another podcast.
Yeah, wonderful. It was a pleasure, and thanks so much for having me, and thanks for all the work you're doing getting this information out there. It's really, really powerful.